After gastrointestinal surgery, the recovery of bowel function is one of the most important determinants about whether or not a patient can go home and really describes their full recovery. Failure to recover bowel function is called an ileus, and ileus can be avoided through a number of techniques both in the operating room and around the operating room. There may even be medications that can decrease the length of time that a patient has an ileus. One of those is called Entereg, and SCOAP has been monitoring its use because the evidence is unclear about whether or not Entereg really has that impact of decreasing the rate of ileus. In SCOAP, we're measuring the amount of time it takes between an operation and the time that a diet was finally tolerated by the patient. We're also monitoring for the use of Entereg, and we're also monitoring the use of epidurals, which may also have a role in decreasing the rate of ileus. If your hospital is underperforming in any of these metrics, it's an opportunity to bring surgeons, anesthesiologists, and nutritionists together to work on these issues, to benchmark off of the many hospitals in SCOAP that are performing better on these metrics, and to use best practices such as increasing the use of epidurals when appropriate. When talking with surgeons, it's important that they understand that the evidence is still being gathered about whether or not drugs like Entereg help to decrease ileus. It's also important that they understand how this metric interacts with other metrics like the use of an epidural. For administrators, it's important that they see that decreasing length of stay by decreasing ileus is a great way to improve efficiency.